which of the following receptor is involved in the activation of RAS system? ANS का क्वेश्चन है. RAS system is renin angiotensin aldosterone system, M1 M2 beta 1 beta 2. Please tell me, RAS system का एक्टिवेशन कहाँ से होता है? The activation of RAS system is seen because from the kidney we have a cell that is given the name as a juxtaglomerular cell, and JG cell पे we have a receptor by the name of beta 1 receptor. So whenever there is any fall in the pressure, whenever the kidney senses less sugar, less pressure, they always cause beta 1 mediated release of renin. Now as soon as renin comes to the circulation, there will always be beta 1 mediated release of renin. As soon as renin comes to the circulation, they will activate a system, very famous system in the body called RAS system. RAS system में होता क्या है? They are going to call angiotensin conversion to angiotensin 1, and this angiotensin 1 that we have is going to get converted to angiotensin 2. angiotensin 1 से 2 में जो बदलता है, the name of the enzyme is called angiotensin converting enzyme, ACE enzyme, that is going to cause conversion of angiotensin 1 to angiotensin 2. And this angiotensin 2 is going to have two important functions. Function number 1, they are going to act on its receptor by the name of AT1 receptor, that is going to cause vasoconstriction. Ultimately the BP will increase. Angiotensin 2, they are also going to work at the zona glomerulosa of the adrenal gland. ZZ मतलब zona glomerulosa, तो adrenal cortex पे काम करता है, and by acting at the zona glomerulosa of the adrenal cortex, they will be causing release of aldosterone. And you already know, guys, that whenever there is a release of aldosterone, this aldosterone is going to actually cause sodium and water retention. Rest of the thing is very, very easy, that whenever there is sodium and water retention, this sodium and water retention will be causing increase in the blood volume, increase in the cardiac output, and ultimately they will also add on to increase in the blood pressure. तो ये भी बीपी को बढ़ा रहे हैं. तो ultimately RAS system का main purpose क्या है? What is the main activity? What is the main action of the RAS system? So the main action of the RAS system that we know, they mainly cause increase in the blood pressure. Whenever RAS system get activated, they mainly cause BP का activation, BP को बढ़ा देते हैं ये. ठीक है? Now one by one let's plot the drug. Let's do our favorite work that we have been doing so far. First and foremost, if I ask you guys that a question is going to ask that renin secretion inhibitor, there is a question called renin secretion inhibitor, and renin secretion inhibitor will be none other than any of the beta 1 blocker, because renin is secreted under the influence of the beta. But if the examiner is directly going to ask you renin inhibitor, so here the answer will change from beta blocker to aliskiren. The answer here is going to change to aliskiren. ठीक है? They are the renin inhibitor, aliskiren. Then we have angiotensin 1 to angiotensin 2 conversion with the help of angiotensin converting enzyme, and this is going to be inhibited by captopril or any of the prils. ठीक है? ACE. So this is going to be April. All the ACE inhibitors, they were born in April. So all the ACE inhibitors, they end with pril. Example like your captopril, lisinopril, enalapril, ramipril, fosinopril, moxapril, perindopril, quinapril. The list is endless. Just remember, all the prils are ACE inhibitors. ठीक है? Now angiotensin 2 is going to act on the AT1, so we can also give a drug here that can block angiotensin 1. उसको हम बोलते हैं angiotensin receptor blockers. And angiotensin receptor blocker, they are all going to end with sartan. For example, sartans like your, let's say we have telmisartan, we have other sartans, losartan, valsartan, eprosartan, candisartan, all of them are sartans. Then we are also having your aldosterone, right? Aldosterone that is released from the zona glomerulosa. We have some drug that can also target the aldosterone. So aldosterone receptor blockers are going to be drugs like your spironolactone, and other one is known as your eplerenone. Spironolactone and other one is known as your eplerenone. They are the aldosterone receptor blocker, increase in the cardiac output because of sodium and water retention, that is increasing the BP. So we can also have some other drug, let's say diuretics can target this area where sodium and water retention will be there. They will be causing flushing out of the excess fluid volume. Okay, so different area पे how to target how to give anti-hypertensive drug, we have studied that how different anti-hypertensive drugs are mainly working at the different sites. Okay, so we have covered this one. Now let's come back to our answer once again. It's very easy, that renin actually released because of beta 1, and that was the starting point of the RAAS system. So correct answer is going to be beta 1. I think all of you guys have got this one. M1 कहाँ पे? M1 is present on the gastric parietal cell, and they are going to cause increase in the acid release. M1 कहाँ पे है? They are mainly present at the gastric parietal cell, causing your acid release. M2 that we have, they are mainly present on the heart. M2 is mainly present on the heart. ठीक है? M2 is mainly present on the heart. Beta 2 is present in many conditions. For example, beta 2 can be present on the lungs. Beta 2 can be present on the lungs. Beta 2 can also be present on the skeletal muscle. ठीक है? Beta 2 is also present on the liver. ठीक है? At the lungs, they are going to cause bronchodilation. Skeletal muscle पे they are going to cause tremor. At the lung, they can cause gluconeogenesis and glycogenolysis, and therefore there will be increase in the level of glucose. And beta 2 can also present on the blood vessel. At the blood vessel, they are going to cause vasodilatation. So at multiple places beta 2 is present, and all their location and function, everything we have covered already in this question.